Thank you for taking your time today to be a part of the Andrea Harris Task Force meeting, and it is our last meeting of the year. I'd also like to thank you for all of your efforts and work thus far in putting forward actions for the task force, as well as your input for the report, which has been finalized and was sent forward yesterday for the governor's review. So thank you for that. And so at this time, I'm going to turn it back over to Catherine. Before I do that, hopefully everyone received a copy of the minutes of our last meeting. Is there a motion on the floor for approval of those minutes? And if so, we will, you can take your vote at the same time that she does the roll call.
I move.
So is there,
John Lumpkin.
Okay. I believe that was Simon. Catherine, did you get the name?
No, I couldn't hear it.
John Lumpkin, I move.
John Lumpkin has moved that we approve the minutes of our last task force meeting. Is there a second on the floor?
Second, Cornell
Pat
Wright.
Martinez, second.
Okay, I think I heard Cornell Wright first, who seconded that. Is there any discussion? If not, I'll turn it over to you, Catherine, for roll call and approval of the minutes, November meeting minutes.
Yes, ma'am. Good morning, everyone. Give me just 1 second. Let me pull up the meeting attendance list. All right. So just as usual, I'm going to call your name. When I call it, please say approved or not approved for the minutes. And of course, if you are present here for the meeting, just for those of you who know who sent me edits for the meeting minutes, I did already go ahead and implement those edits. So it will be the current version of meeting minutes as well, including the edits that were sent to me. So starting out, Adriana Chavela. Andrea Senao. Annette Taylor.
Present and approved.
Anthony Spearman.
Present, approved.
Ben Money.
Present and approved.
Carlos Risch. I think I just saw a message pop up about Dr. Risch. Can someone let me know what it was said?
And I'm working on giving them the correct link there in the breakout meeting session, but they'll be joining us.
Okay. Thank you. So I'll call that name again in a second. Catherine Sevier.
Present, approved.
Okay.
Hi, Catherine.
Yes.
This is Josephine. I just wanted to let you know there were a few of us that ended up in the breakout session instead of this meeting.
Okay.
I tried to send this link into the chat before I left because I wasn't sure if it was the same link. So we'll see if that worked. I'm gonna go back to the other meeting to see if they got the link.
Yeah, got you. Okay. So then I did say Dr. Seaver. So I'll probably go over any of the names that I may have missed or later. CC Lambert.
Present and approved.
Bright. Charlene Green.
Present and approved.
Okay. Chrissy Clayton. Cornell Wright.
Present and approved.
Dale Jenkins.
Approved.
Donnie Lambeth. Gene Woods or Fernando Little.
Good morning, present and approved. This is Fernando Little.
Giselle Corby Smith.
I'm present and approved. Unfortunately, have to be on my phone because I can't get it Microsoft Teams to work on my laptop where I'm in the location I'm at.
Okay, thank you. Gregory Richardson,
Present and approved.
James Johnson Jr.,
Present and approve.
John Lumpkin,
Present and approve.
Jonathan Augustine, Juvencio Rocha Peralta,
Present and approved.
Evan J. Price, Lenora Campbell, Lynn Botany,
Present and approved.
Margaret Weller Stargell,
Present and approved.
Michael Regan,
This is Carolina Fonseca Jimenez sitting in for Secretary Regan, present and approved.
thank you. Pat Martinez,
Present and approved and on the phone.
Queenie Sanchez Lopez,
Present and approved.
Brett Brown, Sonia Richardson,
Present and approved.
okay. Stephanie Megara, Trey Raybon,
Present and approved.
Viviana Martinez Bianchi,
Present and approved.
Walter Backham, Yasmin Garcia Rico, and Yvonne Hawley.
Present and approved.
Just 1 second, let me count these up. Okay. And Secretary, we do have a quorum. I believe I'm passing it on to Emily now.
Yes.
Yes, good morning, everybody. Our first presentation this morning is from the Council for Women Advisory Board, who will share the findings from their report, Exploiting Inequity, a Pandemic's Gendered and Racial Toll on Women and Families of North Carolina. The Council for Women is represented on this task force by their Vice Chair, Annette Taylor. Annette Taylor is the Minority Business and Community Affairs Manager for the NC Education Lottery and an adjunct professor at NC Central University. And she's also on this task force's Educational Opportunity Subcommittee. So Annette, thank you for being here this morning, and I'll turn it over to you to introduce the Council for Women.
Thank you, Emily. Good morning. Good morning, Secretary Sanders, and to my fellow task force members. I'm delighted to introduce to you our fearless leader of the North Carolina Council for Women, Ms. Jenny Black, who has served as the chair since being appointed by Governor Cooper in 2018. In her day job, she's the president and CEO of Planned Parenthood South Atlantic. So she will lead a discussion in the presentation on our report that we developed to address the impact of COVID-19 on women. And Jenny, before you get started, I'd also like to acknowledge that we have several council members in attendance who helped form our COVID task force and contributed to this report that you will hear about today. So at this time, if Jenny is ready and our presentation is set, I do believe we're going to do a presentation. I give you Ms. Jenny Black, Chairwoman Jenny Black.
Hi. Thank you, Annette. Is my audio okay? Can you hear me?
Mm-hmm. I hear you
Great.
well. Yes.
Okay, perfect. Thank you. And Secretary Sanders, thank you so much for this invitation. It's such a privilege to be here today talking about our report and our findings. Thank you, Annette. It's really an honor to hold this position of chair of the North Carolina Council for Women and to partner with the council's executive director, Mary Williams Stover. Shout out to Mary. Our mandate is to advise the governor, the legislature, and state agencies on issues impacting women in our state. And this report was conceived of, interviews conducted with 42 women across the state. The results were compiled and the report written by a subcommittee of the council many of whom are here today. So hi guys, welcome. Thank you for joining us. We really are so grateful to be here to share our work and our recommendations. And I also just want to give a special shout out to my council colleague, Lyric Thompson, who is really the chief author of this report and really led us through this process. So it really has been an incredible team effort. Now, the council's primary work product is the issuance of regular status of women reports that measure various aspects of the quality of life for women in North Carolina. We have the health and wellness report, the economics and earnings report, and the political participation report. And these reports have formed the basis of our understanding of how women are faring in pre-pandemic North Carolina. And you can see the full reports, executive summaries, and all of our recommendations related to each report on our website. And collectively, these reports paint a picture for quality of life in North Carolina. And we believe this picture has a lot of room for improvement. In fact, our beloved state scores in the bottom rankings when compared to other states, earning sometimes C's and D's on these critical quality of life indicators. So even really before the pandemic, we had a solid data-driven understanding that women, and particularly women of color, face deep disparities in our state. And as this pandemic grew, we knew that this likely wasn't getting any better, but probably worse. Can we move to the next slide? By late spring, women's agencies from other states began issuing their calls for a set of post-COVID policies that centered women, and particularly women of color. And we were really inspired by that. And then, of course, in the summer, when George Floyd's death brought about a much needed racial reckoning in our country, we knew that we really needed to lift up the experiences of Black, Indigenous, Latinx, and other women of color in this report. And so what we've tried to do here is to offer transformative recommendations for reducing both racial and gender inequality. We were just delighted when the governor announced the creation of this task force, and especially pleased when the Council for Women was given a seat at this important table. So shout out to my colleague Annette for representing the council as beautifully as she does in everything. So thank you for your partnership, Annette. Can we move to the next slide, please? I really want to root us in why we're doing this work. The Council for Women focuses on women, and especially women of color. So we have this really rich quantitative data set from our Status of Women reports, which is so compelling. This data is incredibly rich, but the one thing that's been missing from all of this data was the real lived experiences of women. We really wanted to hear directly how women were being impacted. And so the questions that really drove us were our policy recommendations still on target? Did we need to consider new recommendations? And maybe there were some positive things that were happening for women that we could recommend keeping. And so we think of this report as a complementary qualitative supplement to our Status of Women reports. And in fact, this process turned out to be really affirming for us, showing us that the recommendations in our status reports have been spot on. Had these policies been in place before the pandemic, women might have started from a much stronger place. And so when designing our process, we were really rooted in wanting to lift up women's voices. Data is very compelling, but when you hear directly from impacted women, it really brings that data alive. And so I really have to acknowledge the limitations here of our process. These women that we talked with were really kind of within the council's 1 degree of separation, right? These are women who were directly kind of within our reach, if you will. And so we have to acknowledge that what we're able to report here is absolutely a best case scenario for how women are faring during COVID. We really weren't able to talk with some of the women that we know are the absolutely most impacted by COVID. Can we move to the next slide, please? Thank you, Catherine, for driving. And so this report and its recommendations are organized thematically to mirror our Status of Women reports. There are a whole host of findings and recommendations that you can explore in our report. So I'm just going to lift up a few here. Women represent 52% of the COVID cases in North Carolina and are taking on most of the caregiving and increased domestic responsibilities. Black North Carolinians make up 22% of the population, but 30% of COVID deaths. Latinx North Carolinians account for 10% of our population, but 31% of COVID deaths. And I have to kind of pause here a moment and say that one of the severe limitations of our data is that the COVID dashboard is awesome, but it does not account for a breakdown by race and gender. It's either or. And so we'd really like for that to kind of be one of our recommendations, that we figure out how to create a dashboard that looks at not just gender or race, but gender and race. Because the women that we talk with, the women who live in the state represent, really living in the intersection of these categories. And we really want to make sure that whatever recommendations we are recommending or implementing are on point and that we're moving the needle. And so that's one of our first recommendations, that we'd like to see some great data benchmarking available to us. And then our number one policy recommendation here is to expand Medicaid. I'm sure that doesn't surprise anybody. But one of the things that we were really struck by was that we've also seen a remarkable increase in demand for domestic violence services, placing a severe constraint on service providers who really haven't seen their budgets increase in 10 years. So the CARES Act provided for a temporary funding increase for DV providers, and we recommend that those funding levels be made permanent. We also recommend that paid leave be mandated and that employers are incented to extend caregiving leaves beyond the end of December when the federal leaves expire. And I really wanted to lift up, I think it's worth noting that many of the women who live in this intersection, they talked a lot about their safety and the safety of their communities, especially in light of current debates around policing, immigration, voter protection, and systemic racism in particular. And several women of racial and ethnic minorities expressed fear for themselves, their families, their communities, violence perpetrated by racist individuals, state institutions, and society in general. These threats included voter intimidation, risks of sterilization in the healthcare system, risk of police violence for Black women and their families, risks of harassment or deportation for Latinx women seeking services, and concerns for missing and murdered Indigenous women and girls. And so women across demographic groups reported feeling intimidated and unsafe due to the insertion of armed white supremacist men in public settings that range from health clinics to polling places. Can we move to the next slide, please? We should be on slide 5. And so we found that, thank you. We found that women aren't leaning out, they're toppling out of the workplace. If they aren't being furloughed or laid off, they are really being forced out by competing childcare, elder care, and sick care requirements. According to the Census Bureau, 19% of North Carolinian women, 22% of Black North Carolinians, and 13% of Latinx North Carolinians have applied for unemployment benefits since March. But because undocumented people cannot receive these benefits, we believe that this number does not represent the total Latinx people in need. And census data indicate that since May, 42% of Latinx households, 51% of Black households, and 36% of white households have lost employment income, with over 1 million North Carolinians as food insecure. These are predominantly Black and Latinx families. And historically underutilized businesses, which are businesses owned by a woman or a racial or ethnic minority, account for 58% of North Carolina's small businesses, 90% of which say that COVID has impacted their business. That's just about everybody. And as early as May, national data showed a 41% drop in African American owned business owners, 32% drop in Latinx business owners, and a 26% drop in Asian American business owners, a 25% drop in women-owned businesses. And that is a trend that was verified by the North Carolina women business leaders with whom we spoke. So based on our findings, we recommend investing in the care economy. And what that means to us is universal pre-K. It means paid leave. It means childcare affordability policies. And we really want to recommend a $15 an hour minimum wage for essential workers. Many essential workers in this economy are women, and we think paying them fairly is a must. And then we'd really like to see a coherent statewide strategy for safe and effective schooling that doesn't depend on the state's women to subsidize the economy with the free labor. Can we move to the next slide, please? And once again, we found that kind of the baseline for women's civic engagement is just fraught with barriers. And in fact, between 2015 to 2020, women's overall participation decreased in most areas, receiving a grade D overall. There were two bright spots though. The share of women who voted increased slightly, and the share of women in the state House of Representatives increased to 27.5%. But the share of women who registered to vote declined before the pandemic. And we suspect that dual threats of exposure to the virus and people of color's valid concerns for their safety at the polls present a real risk that this could further dampen civic engagement. And so what we would like to recommend are to center BIPOC in the state's pandemic response and to increase compensation for legislators. This notion of a citizen legislature is designed to attract a candidate pool that is more affluent, more white, and more male. And that's exactly what it does here. So if we want to attract a more diverse candidate pool, we need to professionalize the legislature so that more women and BIPOC will be incented to run. Can we move to the next slide, please? So we also really wanted to hear from women what's working well in our new reality. We spent plenty of time hearing what isn't working well, but we suspected that there possibly were some things we should think about keeping, right? It's not all bad news out there. And so one of the things we found are that women really appreciate the flexibility that teleworking offers. It doesn't necessarily mean that there's balance, right? A lot of women said they no longer feel like they're working from home, they're living from work. But they also said that teleworking has enabled them to juggle their professional and domestic responsibilities more effectively. And studies have shown that productivity has either stayed the same or actually increased with teleworking. And so we would like to recommend employer incentives to encourage teleworking employees. We think that these kind of incentives will help employers normalize remote working options for their staffs. And we would really like to see incentives for child, elder, and disability care. These are very real needs driving women from the workplace, which is having devastating impacts on their households and their communities and our economy as a whole. And we really want to recommend expanding the unemployment benefit so that it captures more people in need. And lastly, we recommend applying a racial and gender equity lens to all response and recovery policies. In close, we believe this is fixable. We can design a set of recovery policies that center women and BIPOC women in our post-COVID recovery that can catapult our quality of life beyond what it was before COVID. We have the data, the stories, and the right people at the table. And so with that, I'll just say thank you for listening. Thank you for taking our report, and I would be happy to answer any questions that you might have.
Are there any questions for Jenny?
This is Representative Lambeth. Can I make an observation?
Yes, go ahead, Representative.
I just want to comment on the legislative pay. I think that's a very good one. It's an interesting, actually, there's been a lot of conversations since I've been in the General Assembly about that. And I think one of the issues, quite frankly, is neither party has had the will to pursue that because of potential political consequences at the next election. In other words, if I were to propose changes in the pay structure and the mileage reimbursement's 27 cents a mile, and I agree completely with what she said, that then I would be targeted because I was a free spender. And actually, this has been a conversation between both parties and within both parties. And I think we all recognize that it's a ridiculous compensation, if you want to call it that, because it costs more to be a legislator than you actually get paid to live in Raleigh and those things. So it's a one worth thinking about. And because I think one of my perceptions is the average working person can't come to Raleigh and be a member of the General Assembly because they can't afford to do that. And until we fix that, to get more teachers, more nurses, more lay folks are actually out in the trenches, you're going to end up seeing people that look like me who are retired, who have other income sources, or lawyers whose firms allow them to come spend that much time in Raleigh. So I think it's observation. The question becomes, do we have the political to make that happen?
Right. The how is the rub, right?
Thank you, Representative. Go ahead, Jenny.
Not specific to this point, Representative, but my hope is that with the incoming federal administration, a lot of these policy recommendations line up with some of their recommendations as well. And so my hope is that we could see some federal funding streams to support some of the measures that are in our recommendations list here. And so obviously our recommendation is to take whatever funding, whatever federal money is on the table, don't leave that money unaccounted for, that we bring it to North Carolina and put that money to use, making North Carolina a much better place to be a woman and a person of color.
Jenny, I just have a question. Great report, Jenny. Very, very great presentation. My question is, you mentioned that 42 women participate in this report. How many of those 42 women were Latino women?
Oh, that's a great question. Do you mind if I call on one of my colleagues? And I don't know the answer off the top of my head. I can see if I can find out for you and follow up separately. Would that be okay?
That would be wonderful. Thank you so much.
Unless somebody knows. Do any of my council colleagues know and can answer that for me?
I'm not sure the exact number, but we did speak with someone from Siembra NC and some other folks that work directly in the Latinx community, but I'm not sure the exact number.
I don't know the exact number either, but we will find out, and I will give that answer to Annette, who can follow back up with you. Thank you for the question.
Absolutely.
Secretary, I see that Pat Martinez raised her hand.
Do you hear me?
Yes, we can hear you.
Hi.
Okay. Hi, Jenny. Thank you for a great presentation. A question for you regarding the women business owners that I think you said it was 25% that you said when you talked about the impact and the drop in business. You said 25% of business owners dropped out of or closed down. Do you know the industries, or do you have that data that would pretty much give a little bit more information on that 25% of women business owners that are no longer in play?
That was a national stat from a report back in May that looked at, small business across the country, across various demographics. And so I don't know how that data applies necessarily to North Carolina, but I can say that, women business leaders were part of who we wanted to talk to and hear from. And while I can't tie that statistic directly to the North Carolina women business owners, what I can say is that of the women that we talked with, they validated that that tension and validated that they were dropping out of business ownership as well. So Pat, what I can do is, again, I can follow up with more specific data and give that to Annette to share with you as it relates to the national report that we looked at. Again, that was kind of one of the limitations of our data locally, was not necessarily being able to slice and dice it in a way that that matched up. So we're having to make a little bit of extrapolations, right? We know we have a picture of what's happening nationally, but with the limited data that we have for North Carolina, we had to kind of extrapolate a little bit, and that was a real challenge. That's one of the things we'd like to see improved in the future.
Thank you. And I know that I'm blessed because we have Annette on our subcommittee, so we'll be picking her brain.
Yeah, I would like to add to that, if you don't mind, Secretary Sanders. And thank you for that question, Pat. We did interview the executive director of the North Carolina Women's Business Center, who gave us really great information and also pointed us to a study that was conducted by the Women's Business Center and the Institute of Minority Economic Development. And so there is a report that's been taking place quarterly since COVID. So I know that there's some data we can probably extrapolate from there regarding the industries, but I suspect the service industry is one of those. So thank you for that.
Thank you.
And
Catherine, did you
see that Lyric? Oh, go ahead. I'm sorry.
No, go ahead, Jenny.
Lyric put an answer in the chat to the question about interviewees. Thank you, Lyric, for pointing out that there is an annex to the report that does list who all we interviewed. And it looks like there were 3 Latinx interviews conducted for this report. Thanks, Lyric.
Catherine, did you have a question?
Yes, this is Catherine McDowell. I was one of the team that worked on the interviews. And one of the things that did pop up for us when we were looking at small businesses, women owned, the number of nonprofit organizations in our state, many of them are women owned. And the funding that came down first through the PPP and also the state, what happened with the state funding with small businesses, it had allotted certain funding to already prescribed nonprofit organizations, and smaller nonprofit organizations were not allowed to apply for the business funding. So essentially, the way the state funding came down, any small nonprofit organization which serves a huge amount of women and children in our state, were blocked from getting any of that funding. And that has had a profound effect on providing food, shelter, clothing. Thank you.
Thank you. Are there any other questions or comments?
I'd just like to note that our Andrea Harris Task Force team member, Kevin Price, has indicated the reports on the website, on the Institute's website for women business owners.
Thank you, Annette.
I also want to point out something that Lyric Thompson said in the chat. She said, further, the data that we quote throughout the report breaks down demographics by race and ethnicity where the data are available. And she also said, however, for many of the indicators we wanted to track, disaggregated data were not available. Hence the council recommendation that all agencies collect and disaggregate data by at a minimum race by gender, if not all demographic streams, and publicize that information in one place, currently on multiple agency websites, etc. For example, HHS.
Okay. Thank you. Jenny, thank you so much. Thank you again for your time, your leadership with the Council for Women, and we really appreciate you sharing this report with us. And thank you, Vice Chair Annette Taylor. We appreciate your willingness and leadership bringing this forward for us. And thank you to the Executive Director, Mary Williams Stover, for being here today also and presenting the report, and who is working on this every day at the Council for Women, doing the great work. So as we continue our work with this task force, I'm sure that the partnership with the Council for Women will continue, and we can also partner on moving forward policies and actions that will improve the status of women of color in North Carolina, and also improve the status of women in general in North Carolina for all women. The Council for Women has had several, if not the fourth, I believe several reports already released on the status of women in North Carolina. And it is very, really surprising to me, but not surprising to me as a woman, and understanding the content and the data that's in that report firsthand, that the status of women in North Carolina is far below expectations. I don't think any of us would be satisfied with our children or family receiving a D as a score or a grade when it comes to academics, and we surely shouldn't be satisfied with the status of women in North Carolina receiving a D as in dog, because this state not only can do better, we are better than that. And so it is past time to recognize, acknowledge, and to work towards policies that support women's progression and also support women in boardrooms, in the C-suite, in the legislature, in state government, federal government. Glad to see a female vice president about to be inaugurated. But we can do so much more, because this has an impact on everyone. And as I've said before, this is not a women's issue and only, and this is not a women of color issue only. This is a family issue, a community issue. This is a man's issue. It's a statewide and national issue, and it's an economic issue that is hitting your bottom line and your pockets as well as mine. So we can do better, and we need to do better. And I'm sure all of you can tell how excited I am about the topic. So we're going to move on. Thank you very much. And Representative Lambert, as we've said before, with Medicaid expansion, we welcome the opportunity to have a conversation where we can partner and maybe help work on what you raised as a concern, not a concern, but as something that we can work towards. And maybe we can re-energize the conversation for both parties for a common good. And hopefully that will supersede politics and really help the residents of this state. So thank you very much. Are there any other comments? And we can jot that one, any actions down that we have as action items, and follow up with that. Thanks again, Jenny. We appreciate it.
Secretary, thank you so much. It's just an honor to be with you today. And thank you, Annette, and the rest of the task force members. We're so grateful to be here. Thank you.
You're welcome to stay with us, Tiff. Thank you. Okay, I'm going to pass it back to Emily. Yes, Emily.
Thank you. I did just want to make sure that everyone here today from the Council for Women knew that the Andrea Harris Task Force did reference data from the Status of Women Employment and Earnings Report, the Health and Wellness Report, and some of the policy recommendations that you shared today in the task force's report. So that collaboration that you mentioned, Secretary, has already started, and I know that the task force will continue to do that in the future.
Thank you.
So moving on to the next item on our agenda, in a moment, we're going to take a break and transition into our breakout sessions. But before we do that, I wanted to take a moment and share a little bit of information about the task force's next steps moving forward. Today, DOA released an RFP for a policy implementation plan coordinator, and that coordinator will work with DOA and work with the task force to create an implementation plan to help us move the recommendations that were in the task force's 2020 report forward. The implementation plan will result in monthly deliverables given to us from January to June. They might include recommendations, for task force members, for DOA, or for state entities. But we wanted to share that we will continue to have partners working with us and supporting us in this work moving forward. And the purpose of today's meeting is to start that work that we will have more support with. So when we transition to the breakout sessions, the staff liaisons for each subcommittee have reviewed a policy tracker, which has prioritized policy recommendations that were in the 2020 report based on impact, effort, and feasibility. And so we've asked your groups to look at one of the high priority items, and the goal is to leave today's meeting with at least one, maybe more action items that you as a team can commit to accomplishing between now and the next task force meeting, which is on January 13th, 2021. And if there is extra time in those meetings, you can continue to plan for those action items that are necessary for the long-term goals that you have previously come up with as subcommittee. So we haven't done this in this task force meeting before, but hopefully those of you on the call are familiar with this process. We're going to take a break until 11 a.m. I encourage you to join your breakout session at 10:58, but you should in your calendar have your breakout session invitation sent from your staff liaison that normally sends your subcommittee meeting. So by 11 a.m., you should be in your subcommittee meeting. And by 11:30 a.m., we'll meet back in this main meeting room, and subcommittee chairs will share those action items that you've come up with and share the person responsible, and also if there are any other supports needed by task force members to make sure we get them done. If you do not have a calendar invite, please reach out to myself or to your subcommittee staff liaison, and we'll make sure that you have a breakout meeting to go to. So Secretary, unless you have anything to add, I suggest that we go ahead and take our break now and everyone meets in their subcommittee meeting rooms at 11 a.m.
Yes, that's fine, Emily.
Great. Thank you, everybody. See you in your subcommittee meetings at 11. Do we have economic opportunity and business development back?
Okay. So we have economic opportunity, business development. It looks like patient engagement's back as well.
We have environmental justice back. I see Carolina.
Okay.
Excellent.
Emily, is your subcommittee back as well?
Yes.
All right, so that I believe that's everyone then. So I just shared my screen so that everyone can see it. Now we're going to be doing the subcommittee report out. So just like the document that I believe your subcommittee liaisons might have mentioned to you, sorry. We're gonna go through just as usual with the chairs of each of the subcommittees, starting with access to healthcare, ending with patient engagement. I have the 3 questions on here for you. So what policy will the group focus on between now and the next task force meeting, which is on January 13th? What action items will the group accomplish? Who is responsible for those items? And then if time allows, you can report on your immediate steps for your long-term goal. With that being said, each subcommittee does have about 5-ish minutes to report and give a Q&A. And then I'll try to be a little bit fair with the time since we're pretty good on it right now. And yeah, that's pretty much how we will go with that. Once again, raise your hand. We will call on you to speak just to help keep order. If you want to utilize the chat, feel free to do that as well. And yes, also if you've already spoken a lot or asked a question before, try to give time for others who haven't spoken, since we are a pretty big task force, to be able to speak and give their share their voice as well. But other than that, we can get started with access to healthcare. So Dr. Corby Smith.
Catherine, Dr. Corby Smith was actually pulled in a different direction at this time. So I'm going to give the report for the Access to Healthcare Subcommittee. But once I give the report, I definitely would like to invite other members of the subcommittee to expand, if time allows, on the action items that we developed during our breakout session. Since the purpose of today's breakout session was to come up with action items that are achievable and can be accomplished by January 13th, our group decided to focus on broadband expansion and the utilization of telehealth services. That being said, Medicaid expansion is of the highest priority to our group. And at the end, I'll circle back to that, but I just wanted to make sure to state why we made the decision that we did. In terms of broadband expansion and utilization of telehealth services, we know that there are CARES Act funds that must be expended by the end of the year, by December 30th, and there's still money on the table. So Dr. Corby Smith and I plan to reach out to DIT, NC Pro, NC at High Speed to support them in the investment that is, already been allocated, and to ensure that see if there are ways that we can ensure that this money is spent by December 30th to support this goal. Additionally, AARP has already identified individuals to deliver digital literacy trainings, which of course are critical for telehealth utilization. And Dr. Sevier on our subcommittee is the president of AARP and is really involved in this work. And she's going to continue to liaise with our subcommittee between now and January 13th and keep us updated on that important piece of telehealth utilization. Additionally, Representative Lambeth is already working and actually already has a meeting scheduled with Blue Cross Blue Shield to address the telephonic pay parity issue that we've previously discussed in meetings. And will keep us posted by the end of the month on if there are other ways that subcommittee members or task force members can work with our private insurance providers on this issue. And in terms of Medicaid expansion, like I said, it is of the top priority to the group. But since we really wanted to come up with deliverables to report on by January 13th, we didn't spend quite as much time talking about that. But Representative Lambeth, Deputy Secretary Money, definitely spoke on items that are underway and happening this month prior to the February session. So Representative Lambeth, I'll defer to you if you'd like to speak on this item now, or perhaps wait until the January meeting to expand on that. And if any other members of the subcommittee would like to talk about the items we addressed today, hopefully we have just a few more minutes to allow that. Catherine, is that true?
Representative
Yes.
Lambeth, I would just add the subcommittee worked extremely well together. I think telemedicine is a very likely and a high probability for success because there has been a lot of work put in on that, and the pandemic has actually been shining the light on the benefits of telemedicine, telehealth. So that's one we feel very good about. And the benefit of that across rural parts of North Carolina, the areas where access is very limited and people need health care, preventive services, and access to specialists is a very good probability. So we'll be doing a lot of work on that legislatively and continuing to work with Blue Cross and other private insurers on the parity issue, and hopefully can get that all tied down. Access, I mentioned to the group that the governor has actually convened a bipartisan group of legislators that will start its meetings on Friday, and I am a participant in that. Some who actually advocate for expansion and some who are opposed to expansion. But he has pulled a group together to try to come up with a solution to see if we can figure out how to get legislation across the line this time. And we're going to be working very hard on that as well in this session. And both of these are extremely beneficial to North Carolina if we can get one or both, and that would be our goal, to get both of them done during this legislative session that's coming up.
Thank you very much, Representative Lambert, for sharing that information with the subcommittee and for the group today. Does anyone else from the subcommittee have something that they would like to add? Great. And Secretary Sanders, I know that you were able to join by phone. Did you have any questions that you wanted us to follow up on?
No, not at this time, Emily. Thank you.
Great. Catherine?
It looks like Dr. Green does have her hand raised. Dr. Green, do you have anything to ask? Dr. Green, you might be on mute. Okay, Dr. Green, we can't hear you, so could you type in your comment if you had your hand raised for something in the chat and we can address it there. But for time's sake, do we have time for one more question? Hearing none, we will go on to economic opportunity and business development. So Representative Hawley.
Thank you. Rather quickly in our breakout session, we looked at what was considered priorities, and by the next meeting, we hope to have at least some things in the tier 1 and tier 2 areas that we could implement immediately to make sure that some policy changes that can be made quickly. We are still trying to hold out a little bit for the disparity study to see what comes out of that as well. And Tammy, do you have anything? We also assigned some people to some groups to work on these particular things. And Tammy, do you have anything else that you think we need to add at this time?
Sure, Chair Holly. What I would add is I think Trey and Dale are on as well, and
Yeah.
the two of them have two goals that they will be leading for this particular subcommittee as well, along with Chair Holly leading the efforts for our subcontracting plan. So I'll invite them to chime in and share more about their efforts.
Thank you, Chair Hawley. Thank you, Tammy. One of the focuses that we'll be working on is apprenticeship programs. Carolina's AGC has been working with the Hub office on development of an apprenticeship program for diverse suppliers, and we see an opportunity to align with that, to cultivate some of the work that they're doing, amplify it, and perhaps broaden the reach of it. So over the next few weeks, we will be collaborating with them, with the Department of Commerce and other interested stakeholders, and to formulate a plan that we'll report back to this committee in January. Thank you.
And I'm going to be working with CC and Kevin, and we're going to look at increasing economic incentives to encourage hub participation, as well as we're going to be working with Commerce and EDP&C to encourage them to look at, a wide set of criteria when they provide economic incentives for businesses to relocate to North Carolina. Diversity, we've talked about that, is one of obviously the criteria that we'd like to see more of. So I look forward to working with CC and Kevin over the next few weeks and bring back some recommendations to the group.
Thank you all for talking about your little subcommittees. That covers economic opportunity at this time.
Thank you. Do we have any questions for the Economic Opportunity and Business Development Subcommittee? Okay, so seeing none, we will go ahead and move on to the next subcommittee. That's Educational Opportunity. So Pat Martinez.
Pat was dropped from our subcommittee call, so this is Demetria Jones, the staff liaison. For the subcommittee, I'm going to give the brief report out from our group. So our group is going to focus on the priority of assisting, of developing a digital toolkit for digital literacy that will be available to students and their families and in their native language if their native language is not English. And we're going to see if we're informed that DNCR, Department of Natural and Cultural Resources, is already working on something similar. So the first action item on our list between now and January 13th will be to arrange a Zoom or Microsoft Teams meeting with the individuals at DNCR who are involved on this project to see exactly kind of where they are and to present some of the ideas that the subcommittee has to them about, you know, how the digital tool, their visions for the digital toolkit for the students and their families, and to just kind of work with each other to make that happen. So everyone on the subcommittee will participate on that. I will be responsible for reaching out to DNCR to arrange that conversation for them. And regarding our long-term goal, because we were able to get to that, the subcommittee is going to focus on looking at ways to increase and identifying the best ways to increase funding and for area health centers, as well as strategies to develop recommendations to improve diversity in the healthcare workforce. And the subcommittee anticipates reaching out to some of their fellow subcommittee members in different groups to kind of figure out what they're doing in these areas so that we're not kind of doing double work and figuring out the best way to collaborate.
Sounds good. Is that the, do you have anything else to add for the Educational Opportunity Subcommittee?
I do not, that's all.
All right, fantastic. Do you have any questions for the Educational Opportunity Subcommittee or any other comments from anyone on the task force? All right, fantastic. So hearing none, we'll move on to the next subcommittee, and I believe that is the Environmental Justice and Inclusion Subcommittee.
Thank you, Catherine. I appreciate it. I will be reporting out for Secretary Michael Regan today. And what we discussed during our breakout session is focusing on our inventory of aging infrastructure goals. Specifically, the goal is to conduct an inventory of aging infrastructure and buildings, schools, senior centers, etc., that have exposure to radon, asbestos, mildew, and consider remediation projects of impacted facilities for job creation initiatives. So as we focus on this goal, we are planning to work on making the case of the importance of this work by specifically gathering data from our beta counties, which are Edgecombe and Robeson County. We plan to do two main things. The first is to really go into detail of the problem with these sick buildings, as a lot of people refer them to as this way. And then number two is offer the solution. We're going to look at a way, a holistic solution that looks at these sick buildings and creates opportunities to fix them, to remediate them, but create them into green spaces in a way that also promotes job creation within the community themselves, putting specifically an importance and focus on those local businesses, helping to remediate, helping to create green spaces where there were once sick buildings. So that's one of the items that we're going to be working on for the January 13th update. And then another item is just making sure that we have a very clear list of points of contacts that we need to connect with to continue this dialogue, to continue this work and helping us further this particular goal. Our lead on this will continue to be Dr. Jim Johnson. He has been fantastic and leading us in this effort. So I'm happy to announce that he will continue to lead us. And of course, we as a subcommittee will support him in any way that we possibly can. But I hope that that's helpful. Thank you all for allowing us to report out today.
Thank you so much. Do we have any questions for the Environmental Justice and Inclusion Subcommittee or any comments? Okay, so hearing none, we will move on to our last subcommittee. That is the Patient Engagement Subcommittee. So Cornell Wright.
Thank you. So our subcommittee is going to be looking at the capturing of demographic data in its totality for agencies. And so what we're going to do is look at the creation of a living toolkit that's culturally and linguistically competent. And we are going to be working off the foundation of what is going on at Atrium. So Our lead for this work will be Fernando Little. And what we're going to do is make sure that we are working on this document together as a subcommittee, but also making sure that it's going to be done in Spanish as well, so that we can have greater reach to other populations. And our other action item was looking at Medicaid, looking at transformation, working and making sure that we're reaching out to our networks to educate and inform about how we can be connected to that work. And so showing how we're going to do that work with our networks and of education and informing.
Do we have any additional comments for any of the subcommittees or any additional questions for any of the subcommittees? Fantastic. Hearing none, I'll give it back to you, Secretary, if she's able to speak still.
Okay, thank you, Catherine and Emily, and thank you to the chairs and all of you who participated in these breakout sessions and read. I'm having technical difficulty with my microphone on the computer, so I've actually called in on the phone, but yet you guys see me on the monitor. Are there any other comments or additional comments or questions for any of the subcommittee reports at this time? If not, this is our last task force meeting of the year, and I want to commend you all for the exceptional work that you've done up to this point, and will continue, I'm sure. I think a lot has been achieved, and you know, when we had our first meeting, I believe you all were in agreement that we were going to work and are working to be a task force to put forth actions and to implement actions, and not one to just meet for the sake of meeting. And I believe we have achieved that, and we have also hit our target and deliverable for a report. Importantly, this time you've discussed actions that we can move forward on, and that we have a lot of work to do. I'm really pleased that we have an RFP out, which Emily mentioned earlier, to secure resources to assist us with the implementation of these actions. And so I'd like to thank you all for the work that you've done this year. I hope that you all will have a peaceful and joyous holiday season. And we have a lot to celebrate. Though it's been a difficult year, in the midst of it all, we still have a lot to celebrate. And with the announcement of the vaccines that are hopefully going to be authorized for commercial use, that in and of itself gives us hope and gives me hope. And having spent 30 years in the pharma biotech industry, with the majority of my time in quality assurance and compliance and manufacturing, just about all of that time, I have confidence in the safety and efficacy of the vaccines that get approved by the FDA. I do believe that their number one priority remains the same. I believe that that is the case regardless of the politics and regardless of some of the conversations that we hear. That safety is the top priority, and that they will ensure, as well as those manufacturers, that safety is at the forefront. And though things have done much quicker, I think part of that is that there are inefficiencies in the approval of products for the market. I have been a part of those and have worked in that, and I'm glad to see that those have been eliminated, unfortunately, by this pandemic, which causes everyone to think differently. So I believe there's like five, Pfizer, Moderna, AstraZeneca, and Janssen, I believe, Janssen company, that are right there at that forefront and right on the precipice of bringing these vaccines to market. So with that, we should have hope. And It will be a safer way to help us to build protection and an important tool to help us stomp out this awful pandemic, and I believe to bring back some happiness and satisfaction to those who've been devastated all across the nation. So are there any questions before we, Pat, is she still on? I think Pat had to drop off, so she's going to miss me asking for a motion for closing the meeting this time, adjourning the meeting. That should be a Christmas gift to her. But are there any other comments or questions or anything before we end our last meeting of the year? And before I end, I cannot go without thanking Emily and Catherine for their hard work and their continued diligence in making all of these meetings a success, and the liaisons who have worked diligently with the subcommittees. Thank you for your leadership and your assistance as well. You've done tremendous work and done a great job. If there is not anything else, is there a motion on the floor to adjourn the meeting?
So moved, Cornell Wright.
Is there a second?
Dr. Green, second.
Thank you. And so we will be sure to note this in a minute so we can let Pat know that we did the right thing. So everyone, have a happy holiday season and a blessed one. And thank you again. Take care. Happy New Year.